Hi everybody, Seth Teigen, Mission Hospital Chief Executive, checking in again with our Mission family out in the community. First and foremost, a thank you to all of you continuing to offer your generous support for all of our caregivers here during this incredibly challenging time fighting COVID-19. If you don't know, last week was Doctor's Day, and so when we talk about how lucky are we to have a medical staff with this level of talent on it? I would tell you, still considering myself being relatively new to the organization, I have been amazed by our medical staff in critical care, infectious disease, emergency medicine, our hospitalists, pathology, just in every single specialty across the hospital, setting us up to be successful in fighting this disease in our community. So I get asked often, how many patients do you have at Mission Hospital? And first and foremost, we have a responsibility to protect patient privacy. So I won't get into the exact numbers, but I'll tell you there's great hope within the medical community. We recently had a patient come through our system of care, be admitted to the hospital, and thankfully, after testing positive for COVID-19, had a plan to be discharged home and is now quarantined in place. These are one of many examples that are coming through our hospital every day as we're really trying to live out our values and serve this community in a meaningful way. Speaking of our values, I'd also like to share a story with you about Sister Martha Ann. Many of you know Sister Martha Ann, one of the Sisters of St. Joseph, and we've been blessed to have her as part of our ministry for many years. And even though she's not walking the halls here every day, I check in with her by phone often. And I talked to her a few weeks ago, and she said she was praying for the Mission Hospital, praying for the Mission family, and in her words, thanks be to God, we are so lucky to have Mission Hospital in this community. And I couldn't agree with her more. This community continues to amaze me. Again, being a transplant here from the Midwest, I always thought that was the best place in the world to live. I think I was wrong. Now being here in Southern California and seeing how much this community cares about our hospital, our physicians, and our caregivers fills my heart with an indescribable joy. We owe so much to all of you. Thank you for your continued support, your offerings of support for all of us during this time. We're in this together. We appreciate and need your help, and there'll be another update in about a week. Thanks.